Wisconsin has again exceeded 6,000 new COVID-19 cases in a single day. However, we have not yet reached our record of 6,461 cases that was set on Election Day. There are 66 new confirmed deaths today. The 7-day average positivity rate has increased to an alarming 33%, a third of all new tests. The county executive, the governor, and health officials have all asked, but many people aren't listening. So tonight, a doctor who showed us what COVID is doing inside a local hospital is giving it a shot himself.
Our first-hand look inside UW Health's COVID unit continues tonight. Adam Dexter joins us live with the message that doctor is sharing. Adam?
Well, the doctor you're about to meet prides herself in her ability to make sick people feel better. But tonight she says she's not proud about the way many are acting towards the virus. And tonight she's asking for your help.
Dr. Hillary Faust has worked with some of the sickest COVID patients at UW Hospital for 8 months.
Just coughing.
Many of whom she's rarely heard speak, if at all.
Most of them are sedated and on a mechanical ventilator, so they have a breathing tube in. And so we don't get to verbally communicate very much.
Dr. Faust says her team is learning how to treat these patients better every day. Testing has gone from taking days to just hours. And new treatments like steroids and drugs like remdesivir are making a difference. Still, Wisconsin is setting new records for coronavirus deaths, something we hear about, but she actually sees.
To have people be alone in the days and hours leading up to their death is something that makes all of us profoundly sad. It certainly can be internalized, and you feel a sense that you wish you could have done more for someone.
Dr. Faust says it's tough to put a finger on exactly what's causing spiking case counts in Wisconsin. It could be mass gatherings, a lack of PPE, and overall a lack of awareness that's led to the record high hospitalizations in Dane County.
It's been alarming to see, in some ways, just denial of science, that people say that COVID is a hoax or that it's not real. And like I said, I can assure you it's very real.
A reality that Dr. Faust doesn't expect will disappear. And without people deciding to change their ways, we may just be getting a taste of what's to come.
This surge may be prolonged and go on for 5, 6, 7 more months. I wish with all my heart that they were right and that COVID would go away today, but unfortunately that's not the case.
And that means Dr. Faust will likely see more patients under her care. Men and women she can't always talk to. But tonight she's hoping you hear her plea and take it to heart.
If I could ask anything, if people are watching this, it would be that hopefully they keep a family like mine in mind, or our patients in mind when they see this, and remember that even if it seems like one small action isn't going to matter, it will. Every chance that we have to reduce transmission adds up.
And that story was both shot and edited by photojournalist Brian Mesmer. And Brian and I got our first-hand look inside UW Hospital's COVID ward yesterday when we showed you their expanding effort to care for patients. And on News 3 Now on Sunday night, we'll share the final story from our trip inside, where we take a look at 2 nurses who show just exactly what it's like to care for COVID patients.
Adam Dexter reporting live outside UW Hospital tonight. Adam, thank you.